How's it going today? Kiki said, how to cure agoraphobia. Shoot, I'll be honest, I don't have any experience whatsoever with agoraphobia. Sorry that that's not helpful for you. We don't see agoraphobia a lot in vascular surgery. Malcolm Lee said, what's the actual magnitude of a 260 plus when applying to residency? Like, does it really open doors that would be shut without a high score DO student? I mean, Malcolm, I think the biggest thing is how does your entire application as a whole position you? So if you have no notable aspects of your application, whether it's your CV, your research, your volunteering, your community impact, your mentorship, your job experience, your rotations, your letters of rec, if none of those things are notable, then a 260 can make you stand out. It really can. But at the end of the day, it's better to have an application that embodies you as a person rather than just a data point. I will say, though, that a 260, especially from a DO, will be notable to program directors because that's not a score that's seen super commonly overall, and it's seen slightly even less commonly amongst DO applicants. And so that might pique their interest, and that might be something that they remember you by. And so your job during your interviews, once you get the 260, is to not just be known by the guy as a 260 scorer. You want them to know you as the guy who got the 260 that opened the door, but you're also super chill and they really liked you, and you also had a good story, or you also had something else in your application that was very notable. You don't want to just come off as essentially a bookworm or somebody that does nothing besides study, has no hobbies, and is just completely enveloped in the USMLE prep. So at the end of the day, the whole package is obviously critical, but I will say that depending on the specialty, a 260 can open some doors. It won't open every door, depending on the specialty, depending on your pedigree, depending on your letters of rec, but it can certainly help you. And I always tell students, there is literally no reason whatsoever to walk into this application process without an application that you're proud of. There's so many resources, there's so many ways to boost your research experiences, your USMLE score. I mean, even just with 7 to 10 days within the secret archives, I've had students go up 10 to 15 points. So it's crazy the things that you can do when you know what you should be studying. And so that's pretty much what it's all about, man. Again, just to reiterate, you don't want to just be the bookworm person. The 260 is awesome, but make sure that you are doing more on top of that than just studying, which makes it tough. I get it. I totally do. Hopefully that's helpful. If you want to drop some more questions down below that give some more context on your situation or anything that you're concerned about with your application prep, your med school prep, your USMLE prep, whatever it is, just let me know. All right, Kiki said, that's okay. Nor said, hey, I'm applying next year and I'm a US IMG, but I'm currently looking for a research fellowship. How do I apply? Well, it depends on what you're applying for. So the first things first, it's easiest to do research in your local area, right? I mean, there's always virtual experiences, but you want to be in the lab. You want to be connecting with the clinician that's putting the research together. And so start reaching out to the attendings that are in the local area to you. So if you're in Miami, you need to start cold calling places. You need to start emailing everybody within the surrounding 30-mile radius. You will find opportunities. It is very time intensive and it's difficult, but this is the way that you find opportunities that most other people don't know about. And that's really, really critical when you're trying to stand out, because you're going to be applying for research fellowships at the big name institutions, like whether it's Harvard or Mass Gen or UMass or whatever it is. all these big name places, the Ivy League programs, the academic university programs, they all have research fellowships in something or another. But you want to find something that directly benefits you as an applicant. Like, for example, if you want to go into, let's just say, psychiatry, you don't want to be doing a research fellowship in hematology oncology. Like, that's not going to help your application. It just shows that you can do research. You're not trying to become a researcher, I'm assuming, based upon your question. You're trying to become a future physician. And so you want your research to support and bolster your application as a whole. And with that being said, obviously you have to have some opportunity. You don't want to turn everything down, even if it's not perfect. But for example, if you're applying for internal medicine, any branch of internal medicine, any of the fellowships, if your research falls under that umbrella, those can all be very, very helpful, even if it's not the specific fellowship that you envision yourself going into. Because at the end of the day, that changes for a lot of people throughout the course of residency. I mean, I've mentored over 2,000 students at this point, and so many of them have changed what they wanted to do, either right before residency application, or they changed the fellowship that they were interested in once they got into residency. I've had so many students to say, oh, I want to go into cardiology, or I want to go into GI, or whatever it may be, and then they completely change their mind once they get into residency. Either they want to go straight into practice because they're tired of having all these loans build up, or they maybe want to try something that's less time intensive or something that's more outpatient based. And so you learn a lot about yourself in residency. And so I want you to keep that in mind, not to shut out opportunities that are not directly within the fellowship that you're super interested in, but they are even tangentially related that can still be very, very beneficial. So hopefully that helps. But at the end of the day, research fellowships are tough. They're not super easy to come by, and there's competition for them. And you're going to have a lot of your other fellow IMGs applying for the same positions. And so the earlier you start, the more cold calls you do, the more cold emails you do. You can't be burnout or tired from sending 20 emails and getting 20 no's, because that will happen. It happens to everybody. It happens to the best of us. And so I want you to keep that in mind, that just because you get 20 no's in a row doesn't mean that number 21 might not be a yes. And so you can't be afraid to do the reach outs. That's the biggest thing. All right, Sudeep said, ban on exams. Will it help to stop being a bookworm? Dude, I'll be honest, I don't think that the USMLE or COMLEX should have any bans whatsoever, because at the end of the day, it's either knowledge you need to know in the case of step 2 and level 2, or it's study habits and skill acquisition that you need to develop in the matter of step 1 or level 1. Do I think all the information you're tested on in step 1 is useful to you as a physician? Absolutely not. I use so very little of it. But I will say a lot of that understanding is what separates, also teaches you which thing long term and which things to not. Like, obviously you need a critical pathway for heart failure, for renal artery stenosis, for hypertension. All these things play an interconnected role, and if you don't have you don't even difficult to grasp the full pathophysiologic picture. And at the end of the day, if you're trying to evaluate if a treatment protocol is useful or if it's just BS, if you don't really understand it to that nitty-gritty detail, then it's very hard as a resident or an attending to be able to make the correct decision for your patient. So I think that it's a huge advantage to have the step 1, step 2 exams. You just have to know what the value is in each one, understand how to put it in your favor so that you can do best on it long term, whether it's performance-wise, score-wise, or for your future patients, and go from there. It's just all part of it. Nor said, also as a US IMG, what specialties can I get into compared to a non-US IMG? So I'll be honest with you, I don't think that that's a good question. And the reason being is because you can get into any specialty, whether you're an MD, a DO, an IMG from the US, or an IMG from overseas. You can literally apply for any specialty. There's no ban on you applying to a certain specialty. Will it make it a lot harder for certain specialties? Like if you want to match into an integrated plastic surgery position as an IMG, yes, it's very difficult. The match rate is low. But are there people that do it? Well, look at the data. So you need to keep that in mind, not to limit yourself, and you should be going with full force, max effort at whatever your passion is. And if you're passionate about, let's just say, PM&R, let's say you want to help rehab athletes, just because there's not a lot of people from a similar position as you that have gotten into that specialty, that doesn't mean you should give up on it. I was the very first DO from my school ever to match into vascular integrated surgery. And I was one of the first, I think, 5 in the country to have done it. And so is it possible? Yeah, 100%. I mean, I'm living proof. I've also gotten multiple mentees into vascular integrated surgery now at this point. Is it easy? No, not at all. I mean, I've even gotten other DOs into vascular integrated surgery this year. So it's 100% possible. You just have to know how to do it. You have to have the mentorship to get there, and you have to be willing to put in the work. So no matter where you come from, whether it's MD, DO, IMG, US or non-US IMG, it doesn't matter. You can make the best of the situation and come out on top. All right, next question. Amir Taha said, what are your thoughts on using letters of rec carried over from the last ERAS cycle? So I think that that's fine as long as the letter of rec is updated and appropriate for you. So for example, if the letters of rec from somebody that you did a rotation with in 2018, obviously that's so long ago that you have changed a lot as a future physician since then. I mean, that's 6-7 years ago. And so you want to make sure that the letter of rec absolutely is an up-to-date representation of you. And if it's not, then I would highly recommend you to get another letter of rec. But on that same note, you might not know what the letter of rec says. Like, I recommend my students to waive the right to view the letters of rec. And so on that same note, there's a possibility that maybe the letter of rec was not as strong as you thought it was. Maybe the attending didn't support you in a way that they had intended, or maybe their wording was not clear, or maybe it left a little bit to be desired. And so you have to think about that when you're in the reapplication process. Maybe that was part of the problem. You never know. And so if you've waived the right to view your letters of rec, then sometimes it's best if you can get a more up-to-date letter of rec from somebody you've worked with more recently, and perhaps that might be the little extra push that gets your application onto a different program director's desk. Noor said, thank you so much. Absolutely. Happy to help. Malcolm Lee said, good clerkship evaluations, average preclinical grades. I was an average student, just work hard. Highest NBME was a 231. Never imagined what this process would look like from the perspective of a 260. Well, I mean, dude, at this point, there are so many people that are scoring 260s that never believed that they could do it. And I don't want you to give up on that. Whether you have to push your test date back a little bit, whether you have to reach out to a mentor, whether you have to reach out to somebody from your school who has done it before you and see what they did, you can't be shy. You have to get that done. If that's part of your goal, maybe right now your goal should be to break 240. And then maybe a month from now, your goal should be to break a 250, and keep scaling it up like that, because you're not just going to go from a 231 up to a 260. It's almost impossible from one test to the other. But you can make small jumps. You can do it over time, but you just have to change something than what you've been doing. Because if what you've done this whole time in the past has only got you to a 231, then that means that you just need a different approach. Malcolm Lee said, not trying to be boastful by any means, it's just been hard finding good perspective. I get that, man. I get that. And Malcolm said, I'm sorry to clarify, that was my situation. I got my score back last week. I understand, man. Well, one thing that you can do now is make the rest of your application as on point as possible. Whether it's taking step 3 early, getting that done with, and having that score to also boost it, or whether it's getting an extra research publication, reaching out to some mentors in that regard, whether it's doing some extra community service to boost up that application aspect. I mean, there's so many things you can do that you can't let your score hold you back. If you're applying for a hyper-competitive specialty, it may be difficult with the 231. one because some of the score cutoffs are 240 and above. It just depends on what you're applying for. So I don't know what you're applying for. I don't know about the specifics for your exact situation, but definitely just keep that in mind. And brother, there's no reason to apologize for all the messages. That's what I'm here for. Feel free to drop any messages in the chat that you guys are wondering about med school, residency, even applying for attending jobs. That's what I'm doing right now. I'm down in Florida. I'm on my last 2 or 3 days of job interviews, trying to lock down a vascular surgery job and see what's out there. Sudeep said, chia seeds on vascular health. I'll be honest, I don't know if there's any randomized controlled data on it, but a lot of the esoteric health hacking I think is actually pretty beneficial. And I'm not on this live stream to really give medical advice per se, but definitely is something you should do some research into. For a second. What other questions do you guys have? Incentive to improve cardiovascular health. Dude, back in ancient times, in the hunter-gatherer times, they were not sitting around. They were walking. And I've firmly believe that humans have developed over the years and should be still walking. We should be putting in the 10 to 15,000 steps. I've seen it have a really positive impact on my patients that do it, on my own life that whenever I do it, my parents' life. I think that the forward ambulation is key. And I know that's difficult, but there's things that you can do. I mean, you can get a standing desk or a treadmill desk, or make sure that after each block of practice questions, you go out and take a 30-minute walk to cool off while also mentally reviewing the concepts that are in the back of your mind that you just studied. There's all kinds of ways to integrate that. Rather than taking the elevator, take the stairs. Every single time that you go see one patient, make sure that you are taking the stairs in between flights. It's super, super helpful. It adds up over time. And it also increases your basal metabolic burn. And so if, let's just say your metabolism burns 1,000 calories at baseline, if you did nothing all day, if you add in those extra steps, maybe it bumps it up to 1,500 calories of burn, and you did basically no extra effort besides being more proactive about your day-to-day step intake. So that's number one, is increase your steps 10 to 15,000. Number two is include HIIT cardio, high intensity interval training. I found that to be extremely useful, not just for cardiovascular health, but also for releasing your brain-derived neurotrophic factor, your BDNF. It really, really helps you out in that regard. It's going to help your mental processing speed. It's going to help you think quicker. It's going to help you be able to make connections better. Look up BDNF if you have not looked it up before. Number three, obviously you want to make sure that your diet is on point, because if you do all this stuff and you eat McDonald's every day, then that's not going to really balance out at the end of the day. So make sure that your diet's on point. I know that there's a million different diets out there, but what I've seen the best results personally from is just eating clean. Like if you cut out the excess seed oils, the extra processed food, stuff that is rich in color, whether it's greens, foliage, fruits, vegetables, having a good balance of your meats and bread, like not overindulging in any one or the other. I don't think you need to hyper complicate things. I think that the problem that people face is they get decision making overwhelmed. And whenever you have too many decisions, like if you should do keto, if you should do intermittent fasting, if you should do daily 24-hour fast coupled with alternate days of eating, there's a million different eating patterns and eating strategies. But I think if you just pick something that's reasonable and that you're going to stick to, you're going to be much better off than the person who binge eats every 5th day because they've been starving themselves the rest of the week. So just think about it. I think if you do those 3 or 4 things, that will really help you getting in the 10 to 15,000 steps, doing the HIIT cardio, making sure your diet's on point. All these things really, really add up over time, and it's almost a compound effect. The compound effect is that you're not just going to see a small improvement in your cardiovascular health. You're going to be able to get less fatigued when you're playing with your children, if you have any. You're going to see less fatigue when you're in the gym. Your muscular endurance will inevitably go up because your cardiovascular endurance goes up. It's all interrelated, and if you look at everything as just an isolated part of the picture, that's where people really fall off. So I think you should steer away from focusing early on all the intricate dieting like the keto and that kind of stuff, and just do what's reasonable, and you should be fine. Sudeep said, knee joint might go on a toss with too much of walking. Well, I think it all depends on who you are as a person, but your joints should be able to handle 10,000 steps. Maybe if you're older or elderly, it might be difficult. Maybe you've had a previous injury, it might be difficult. And at that point, I think it's best to speak with a doctor that personally knows you and can evaluate you in person. But all the advice I was just giving is for somebody that's a generally healthy, middle-aged person. So, all right, guys. Well, if there's no other questions, I'll call it a day here. Hopefully this was helpful. Let me know if you guys need anything else, and we'll talk soon.